So we're here in Geneva where the world's governments have gathered in the final round of negotiations for an international legally binding treaty on mercury. Mercury, the toxic substance that is pervading the environment. It's released from coal-fired power plants, from small-scale gold mining, from medical devices like thermometers and blood pressure devices, from batteries, and that is contaminating food chain. It's bioaccumulating in the food chain and ending up in our fish. And for the last couple of years, the world's governments have been negotiating this treaty to restrict the trade and the use and the emissions of mercury around the world to protect public health and the environment. And this is the final round of negotiations. And this is the last day of a 6-day meeting. And the world's governments and the non-governmental organizations that have been following these negotiations and participating in them have been working around the clock literally from like 9 in the morning till 3 in the morning the next morning, every day, trying to finalize text and get this thing done. And it's almost done. The reason that Healthcare Without Harm is here is that we have been working for about 15 years on substituting mercury-based medical devices, thermometers and blood pressure devices, which are known as sphygmomanometers, with safe, accurate, affordable alternatives like digital thermometers and digital blood pressure devices or aneroid blood pressure devices. And we started in the United States. We've basically phased it out there. The European Union has basically phased it out. Countries like Argentina and the Philippines and Chile and Mongolia have issued national policies as a result of our work and our collaboration with the World Health Organization on this issue. But there are still many countries all around the world that use the mercury-based medical devices. And this is something that's totally affordable and totally technically viable to do. And so we've been working on this for a number of years, and we've been involved in this treaty process to basically get a global agreement to phase it out, and we're on the verge of getting it. When they finish this meeting tonight, we should have an agreement that mandates the phase out of mercury-based medical devices by the year 2020 around the world. And that means we're going to end the production of mercury thermometers, the production of mercury blood pressure devices, and we're going to see the production of the alternatives increase and the use basically be ubiquitous in hospitals and health systems and pharmacies around the world. So, while we feel like we're on the verge of success with the phase out of mercury-based medical devices, and there are a lot of other products like button cell batteries or switches and relays that are being phased out, there are still some big problems with this treaty. It is not a bouquet of roses, this treaty. It's got some real problems. And the big problem, one, coal-fired power plants, and two, small-scale gold mining where mercury is used and emitted and is poisoning people and making people sick. So both of these are the biggest source of mercury emissions in the world, and neither of them have really solid regulation coming out of this treaty. The world's governments have not been able to agree on how to seriously reduce emissions from coal-fired power plants, which are expanding around the world, especially in India and China, or from small-scale gold mining, which is a big issue in places like Indonesia and Brazil and the Philippines. And so what we're seeing is a treaty that is going to take some serious measures to reduce mercury emissions from around the world. But at the same time, there are some serious mercury emissions that are going to continue. So what's not clear is that whether on balance, whether this treaty will in fact ultimately reduce overall mercury emissions, or whether they're going to continue to go up, but perhaps at not as rapid a rate. It's an important step forward, but it's just the beginning of a much longer effort to try to address this big global environmental health problem. So, one thing's for sure is that, once this treaty is agreed upon, that's going to be signed in October by the world's governments, and then they're going to ratify it, and then it's going to enter into force, and we're going to start seeing the measures being taken more or less immediately, even before that happens, to address a lot of these problems. And we are Healthcare Without Harm is really excited about this 2020 target to reduce or to get rid of mercury thermometers and blood pressure devices. And we are getting ready and gearing up to work for mercury-free healthcare in 2020. And we're going to continue working hard on this until we have achieved total success, and we're excited about that.